And a little bit of background, he's done his MBBS from Maulana Azad Medical College in New Delhi, and then his MS also from the same college, and he's done his MCH in surgical oncology from Cancer Institute in Chennai. And he's been in Chennai for long, and he's also a member of European Society of Surgical Oncology, Society of Surgical Oncology, Association of Surgeons of India, and of course Tamil Nadu Association of Surgical Oncology. So I'm not going to take much time, and without much delay, please welcome Dr. Mahajan on the stage. And we're going to talk today about a burning issue, which is awareness and prevention of cancer. And this is an interactive session. So I would request all of you to first attentively listen to the presentation, and then we're going to have an open session where we're going to invite questions from the audience who's present here, as well as our colleagues who are logged in from other parts of the country. Now, please give a big hand to Dr. Mahajan.
So thanks, Jeet, and it's a pleasure to talk on these topics and men awareness, men health awareness. I'm only basically going to talk about prostate cancer today, but you can ask whatever related to cancer prevention or something, whatever I'm able to answer, I will definitely answer. Although my specialty is more with relation to the stomach and the abdomen, whatever cancer there, as well as in the chest. I don't commonly handle head and neck, oral cancers and all, but I can give you idea about all these things also if you ask a question on these things. So, really, it doesn't matter if you are able to hear it. Exactly like okay, what? Just one second. Just check it. Okay, so yeah, that's better. Prostate cancer is, I don't know whether you know what is the prostate gland first thing, but it is one of the most common cancers. Doesn't happen in younger age group, mostly is in the older age group, mostly after 50 years. And the prostate gland is basically a part of the male reproductive system. I will just show you some diagrams in which you can realize that what is the prostate exactly. And because it's one of the commonest cancers in males, just like breast cancer is common in females, so it is important for the men to know that how to get it diagnosed or what symptoms to look for, as well as how to prevent it. So it's a small gland basically, and it is located just below your urine bladder, where the urine collects, and through this prostate glands only your urine passes through, because the tube which passes through that then goes on to the penis, through which your urine basically comes. And its main function is that the spermatozoa or the sperms are basically nourished by this, and it provides a medium for it to come out. When an ejaculation takes place, whenever you have sex or you masturbate, the ejaculate comes out, and for it to have a medium, the sperms, the fluid comes out from the prostate. Okay, so this is basically, yeah. So this is a diagram. I'll just tell you what exactly. Is there a light in this? No. Light is coming? Yeah, it's coming. Can you see something? No. Okay. So basically, this is the bladder, and this is the urine passage. You can see that yellow thing which is going, and this is the penis, as you know. Yeah. So the urine passage starts here. So around this area, this green color thing is the prostate gland. So the urine passage basically goes through that. Okay, so urine goes like this and it comes out in the urine comes out from the penis. So basically the prostate is in this area, it is inside. Now this is another diagram, again similar, that there are various parts. We will not go into details of that. And if the prostate becomes bigger, so it compresses the urine passage, and you have this people who in the old age they will have urinary frequency and they will have difficulty in passing urine, or suddenly the urine will stop and go rush to the hospital to get a tube pushed in. So that is most commonly because of this, which is not a cancer. That is just the enlargement of the prostate. As everybody becomes old, these problems can come. So, as I mentioned to you, it's mostly in an older age group, 50 years. Normally, it is not so common at 50 years. Most patients who come to us are above 60, 70, like that. And earlier, all these cancers used to come in only advanced stage, because patients will not have any problem, or if they have a urine problem, they will not go to the doctor. Who is going to go? They will be examined, they will put a finger here, put a finger there, so don't go. So, but in the process, the prostate cancer used to spread to the bones all over the place. So, almost 70 to 80% of the patients will come in an advanced stage. This was the situation till even 2000, maybe even 10 or 2005 or so. After that, the patients started coming in an earlier stage because of screening. Although screening is not common in our country, it is mandatory in US or in Europe and all. So they pick up these cancers much earlier. So after 50 years, usually it needs to be screened. We will just come back to it later. And it is the second leading site of male cancers in Delhi, Kolkata, Pune, Trivandrum. Not in Chennai as yet, but in Chennai also it is something around 5th in the males. That is the 5th most common cancer in male. And it is increasing. In all these cities also it is increasing. Family history of prostate cancer or family history of breast cancer in the same blood relations sometimes increases the risk of breast cancer in the lady. Say mother has a breast cancer, the son can have a prostate cancer later on in his life. It's something of that sort. It of course involves some genetic this thing. So not all breast cancer patients who have children, they will have prostate cancer. It's only a small percentage of them. Of course, as for all cancers which are increasing, lifestyle and dietary factors play a big role in these things. So these are the various factors. Again, diet. I will only concentrate on the diet. A high intake of red meat, mutton, chicken, beef in this part of our country. Dairy and of course saturated fat. Excess intake of that, and there is sometimes higher testosterone levels. So some people who are doing some gymming and trying to build up muscles, and they take these injections, anabolic steroids or testosterone, sometimes they may have some role in development of these cancers. And of course persons who are obese and who have a sedentary lifestyle, not doing any exercises, only sitting, and mostly the IT group, people who are mostly sitting in one place and doing a job and not doing any exercise. So it is a big epidemic in our country, and all these cancers, not just prostate, colon cancer, stomach cancer, esophageal cancer, all these are increasing because of these problems. So I mentioned family history is mainly related to a gene called BRCA1, which is more for females who develop breast cancer. We will not get into details of that. So in some cases, of course, genetic counseling may have to be done. It doesn't mean that if they develop prostate cancer, they're going to die. They will be, it is just that you know that they can develop. So screening is important in these patients. These are the symptoms which are common for a general prostate enlargement also. A general prostate enlargement, anybody who's above 60 or 70 can have some frequency of urine. Night time they have to wake up again and again to pass urine, or some discomfort in the lower part of the abdomen. All these are symptoms, but otherwise most patients may not have any problems. So screening to pick up early cancer is very, very important. And as I mentioned to you, prevention. So this is not true only for prostate cancer. This is true for your any colon cancer, stomach cancer, prostate cancer, all these things. It is common, or smoking or any tobacco intake. Actually, I have not mentioned tobacco here. but smoking or any kind of tobacco intake also has a role in the development of prostate cancer, and avoidance of all these things can reduce the chances of cancer for not just prostate but so many other cancers. So addition of some fruit intake, a lot of people, I can tell you, I never took any fruits when I was a student in a medical college. Neither we had the money nor the inclination to have, so that is not a good habit. So if you have not have the habit of eating fruits or salads, please make that habit now. Okay, there is no, it's nothing is early. You can take it now. So take tomatoes basically for lycopene, which is again a preventive factor. Takes, as I mentioned, fruits, vegetables, increase their intake. Regular physical activity is the most important part for everybody to reduce a lot of lifestyle related diseases, including cancer or cardiovascular or heart problem. Anything you say, if exercise is done regularly, that will reduce. It will not prevent it completely. So don't think that if you do exercise and take good vegetables and it will not develop cancer. It will still develop, but chances are less. Smoking, alcohol excess, of course, it all has to. Now alcohol has been proved that it causes certain cancers, most commonly esophageal cancer, and therefore a warning is now going to be put on alcohol. Body can cause cancer, just like smoking. So screening, as I was mentioning, when nowadays there are plenty of companies in the market who get a series of tests, 100 tests for 3,000 rupees and 2,000 rupees. What you have to see is significant or important tests. In that, after 50, a PSA test is very important. It's a marker for prostate cancer. So PSA and examination. So once in 2-3 years, a digital rectal means you will put a finger in your motion passage and examine. This is an uncomfortable. If you are going for a medical checkup, there are so many medical checkups in various hospitals. Examination is also part of this thing, and if they are going to do a rectal examination, don't refuse. A lot of people refuse. No, I don't want to get it done. That is not correct. So this is part of that. And so the healthcare provider, especially if you are over 50, not before 50, there is no need to do all these things. I don't advocate getting all kinds of blood tests for these things. But in above 50 years, you need to get this done. However, you also have to know that when you go for a screening, especially if say PSA is high, what will they do? So if the PSA values are high, they will ask for a biopsy and will do a MRI. Sometimes, unfortunately, there are situations where the PSA is high but there is no cancer. So that is basically results from if you have some kind of an infection in the prostate or simple urinary infection, the PSA can be high. So the doctor who is dealing with you has to be aware of all these things and not do unnecessary investigation. Sometimes a biopsy can cause a lot of problems. One must be aware of these things. So just because always it may not come out as a cancer. It can lead to all these complications like infection and your urine may stop, and it can be a really troublesome situation. Then there is also called chemoprevention. So there are some new drugs called finasteride and dutasteride which may reduce the risk of prostate cancer. And of course intake of vitamin selenium, but these are not, there is no concrete evidence. In medical science we always need to have a concrete evidence. So if you are going to take this for 10 years, it needs to be taken by say 20, 30 or 1 lakh people, and then you see how many have developed prostate cancer, and you have to have another set of people who don't take this, what is the chances of prostate cancer, and then you say okay, this medicine is useful. So that is very difficult to do. So these are all mixed, so they are not routinely recommended, but the other two they may reduce the risk, but you must understand that the drugs which are given for even for prostate enlargement, they do have some side effects. Your libido or the will or the chance that you want to have sex or ejaculation, they may stop. So those things are not commonly told, oh you can get the medicine, but they have side effects that you are aware of. Thank you, and open to questions. I hope you are able to understand what I am telling. So
Thanks, Vikas, for this very nice presentation. So now we'll throw open the stage to any questions to the doctor here. Please go ahead and ask. And also, this is open to all our colleagues who are logged into on YouTube. So please post your questions on the WhatsApp group which we have created, and we'll be happy to take it up on your behalf. Thank you.
It's not necessary that you need to ask about prostate only, because I see mostly younger people also. So if you have any queries or something, and as I mentioned to you, these are all preventive for other cancers also, which is colon, motion passage cancer or rectal cancer. So these are all important in this also. Yeah, go ahead.
What's the most common cancer for younger age?
For younger age, commonly cancers do not affect younger age people, but you have blood cancers, or we call them lymphomas or leukemias. Those are more common in the younger age group. There are other, each segment of age has got some cancers, but the incidence or the chances of developing are very low. So you have cancer of the testis, your balls which are there. So cancer of that, usually in the 15 years, 20 years, 30 years age it can come in that age. And there are some bone cancers are there which are common in the younger age group. So we call them osteosarcoma, Ewing sarcoma. So they are all either in the very young age to up to 25 years. So in that group, these are common. Similarly, your other, as I mentioned to you, there is something called soft tissue sarcomas. So your muscle, your tendons, from their tumor arising from those things are also more common in younger age group. They are there in older age, but they are more common in this age group. But if you look at the incidence, means per million population or per lakh population, how many cancers, they are very low. You have colon cancers, they are much higher in the above 50 years. Breast cancer above 50 years. Doesn't mean that breast cancer cannot be there in a 20-year or 25-year-old lady. But it's commonly there after 50, 60, more common. So the older you become, the more are the chances of cancer. So old age is also this thing for developing cancer. Does that answer your question?
Apart from dietary thing, what are all the measures that we can take to prevent or control this?
So dietary is one part of it, and exercise is one second part of it. Avoiding smoking. If you have to drink in this thing, you have to be doing that in moderation. I am not advocating alcohol at all, but it has. If you are doing it, you have to be careful doing it in moderation. These are the main preventive factors. Have a good sleep, relaxation. Any problem is there, go and meet the doctor at an earlier this thing. So main preventive factors are smoking, alcohol, diet, exercise. These are the more modifiable factors. Genetic factors you cannot modify. So you cannot change your mother and father. So whatever is there in the family has to be there. So that way. But when you know that there is a problem, you may not either get married or you may not have a child. You can adopt a child. Problems are not there for the next generation.
People say that when you eat a lot of junk foods and having a lot of soft drinks to the children and all, they get chances of getting cancers.
Are more.
So is it true?
So yes, it is true. Basically, it is the diet. As we mentioned that fried foods, a lot of fried foods, if you are deep frying, there are certain chemicals which can get released. How old is the oil? How hot is the oil? All these factors are more deeper. If you go deeper into it, these are factors which make a difference, which you will not know. So anything with lot of oil, anything with no vegetables, children don't want to eat vegetables, so that is not okay. So junk food. Similarly, your cold drinks. So cold drinks will have a lot of sugar. So it will cause obesity if you are not working it out. If you are working it out, everything, running every day, then it is fine. But if you are not working out the sugar which you are taking, it will convert to fat, and either your liver will get bad or your body will become bloated up. All these are all common problems. So children, again, more and more children are becoming obese because of these things. So it needs to be the norm is that if children, you cannot tell them that you cannot have a pizza, but you have to say, okay, you will eat home food every day. One day in the week, one meal you can have junk food. Other time you have to eat. So that is compromise you have. Otherwise, the children will revolt.
Sir, sir, in 2025, cancer is curable or not?
So, in 2025, cancer is definitely curable if it is picked up early.
Okay.
So, we have even say this particular cancer, prostate. So, earlier, as I mentioned to you, most patients will come late.
Yes.
So, they will be in stage 4. They will not get cured. We will give treatment to just prolong their life. On the other hand, if they come early, the treatment is given, and in prostate cancer, the patient will live for 20, 25 years. So, they will be cured basically. So same way, all other cancers, if they have come early stage, there is a very high chance that they will be all right for the rest of their life. So breast cancer, there are plenty of breast cancer comes to us, and we nowadays talk to them that okay, it's a lifestyle disease, don't get worried, get the treatment. Yes, you will have a lot of treatment depending on the type of cancer you have. But after the treatment is over, there is a very good chance, 8%, 70%, 90%, depending upon the stage, that you will be all right. So same is true for colon cancer, same is true for stomach cancer, but it has to come early. Okay. Then there are a lot of newer treatments have come, which also have increased the cure rate. So yes, there is in 2025, a lot of cancers are curable, but they have to be picked up early.
There's a news floating around that Russia recently they started distributing vaccines for cancer.
Okay, so there are certain vaccines are there for certain prevention of certain types of cancer. So you know there is the mouth of the uterus is called cervix. So in females, cervix cancer is a common cancer. Okay, so this cervix cancer is basically caused by a virus which is called papilloma virus. All right, and it comes because of the man or the woman have multiple partners. Alright, so it's a sexually transmitted. That is not told commonly because it will lead to a lot of trouble. If somebody has a cervix cancer, the wife will tell, oh, you must have gone somewhere. So, but this HPV, there is a vaccine which is now available. It's already available for some time. It's called Gardasil. But India has also made a vaccine which is supposed to become a very cheap vaccine, and therefore it will be, I don't know, Russia has this vaccine or not. Now, on the other side of the story, there are a lot of cancers for which individual cancer, this cancer cell is taken and a vaccine is produced for that. So those are very, very expensive treatments. Very, it will cost you some 50 lakhs to 1 crore, 5 crore, 2 crore like that. So it is not a common used at present, but these are getting developed. For individual person, from their cancer cells, a vaccine can be made. These are the at present the common this thing. There are other cancers in which are caused by viruses, for which like hepatitis B virus. Hepatitis B virus is a virus which is causing your jaundice. Okay. Now that hepatitis B is also caused by blood taken from a person who is hepatitis B positive and you have not tested it, or again sexually transmitted if you have had unprotected sex in a prostitute setting who's positive already. So, or basically it is blood has to be transmitted or body secretions can get this thing can cause. Hepatitis B nowadays is a common vaccine for all kids, small babies from at the start of their this thing. So what it prevents is liver cancer. So liver cancer, one of the main causes is hepatitis B virus, hepatitis C virus, and of course alcohol and other causes are there. But the hepatitis B is prevented by getting the vaccination at the childhood. So in China, Japan, of course in all our countries, it is reducing, the incidence is reducing because of the virus causing, but there are treatments also nowadays available for that.
How to find the cancer early stage? Early stage, mostly it is asymptomatic if I'm not wrong.
Yeah.
So how to find in the early stage?
So certain cancers you need to get it screened. Unfortunately or fortunately, In our country, the cancers have such a high incidence that it can be screened by government. Like you have stomach cancer, which is relatively common in Chennai, but if we say that it is, say, in 1 lakh people, 10 patients will develop stomach cancer in Chennai, it will be more than 100 in Japan. Okay, so in Japan, everybody is screened yearly or 2 yearly for stomach cancer, but we cannot screen for 10 people in 1 lakh. It becomes too much of an expense. For you have to do endoscopy for 1 lakh people. Remember, that is the breast cancer in Western countries is very common. It's much higher than what we have here. So screening is done. So here we advise that if you have all ladies in the higher socioeconomic or the lower, they should go for own screening. So breast cancer screening. Similarly, cervical cancer, as I just mentioned, in females, it can be screened very easily, not very expensive. So they can get the screening themselves. Of course, government also does some amount of this thing. Other than that, for males, the common thing is oral cancer. So you have to go to a dentist. If you have a habit of chewing or something, tobacco or Bethlepark and all these things, then you have to go to you have to stop it and go to a dentist. He will see inside the mouth. Anybody just in their mouth, they can find out if there's any problem. Then there are certain symptoms, swallowing difficulty, change of your voice, which is all persisting for a month, bleeding in urine, bleeding in the cough, you are having a persistent cough, persistent fever is there for more than a month, already been treated by multiple methods but it's not settling, repeated infections, weight loss, blood in the motion, some black color motion. So these are all symptoms which you, if you have, you need to go and get it reviewed by the doctor. It does not mean that every lump in the breast is a cancer. You understand? So just because you have to have this doesn't mean you will have, but you need to go and check it out. Then you will pick them up early. So that is the first way. If you have some of these symptoms, you can go and check with the doctor. Other ways, of course, screening. So screening is not, normally screening is something in which you do screening for, our population is 1.4 crores. You leave aside all the 1.4. If you include, say, 80 or 70 crore who are in the 50 plus population. So that also is a huge number. To screen so many people, you need crores of rupees and crores of people to do the screening. So not physically possible in our country. And it is not cost effective as to a Western country which have a very small population, so they can screen more easily also. So that is, so individuals have to take the initiative to go about and get themselves screened. Then they will pick it up early.
Okay, few other questions have started coming on our group. Is there any connection between diabetes and cancer? And what kind of preventive measures should a diabetic person and how does he get up?
So diabetes basically as such may not have much of thing to do with cancer, but remember diabetes is a metabolic disease, and the one is an insulin dependent diabetes which happens in younger people. That has got nothing to do with this, but the ones which all of us can develop, that is a non-insulin dependent diabetes, is mostly related to obesity and all, lack of exercise and dietary, what you eat and all, depends, and of course genetics also. So in that, if you are not controlling your diabetes, you will become more obese. So all other cancers will get increased. But diabetes per se may not be the reason for it, but the other factors are reasons for developing a cancer. However, if the, say, diabetes is there and suddenly the control becomes worse, you have to give more insulin, you have to give, and the control is not okay in spite of your taking measures, it is an indirect way to say that you may have a pancreatic cancer. So that is one this thing which is there. Other than that, diabetes, if the person has a long-term diabetes, sometimes there is an increased possibility of breast cancer also. So these are not all proven things, but they are all related to your metabolic body, whatever body you have. On that basis, you say, okay, you have diabetes and cancer. Yes, there is some increased chances of cancer because of your dietary problem.
What are the symptoms which one needs to be wary of? Maybe you can put it an age group or whatever. I don't know. It's a little generic.
Yeah, so there's no generic in this. Basically, there are some 7-8 symptoms we say you have to know, and if you are having any of such this thing. So I told you some of them, like bleeding from the motion, color motion, bleeding in the urine, bleeding in cough or sputum which is there, some bleeding from the mouth, from the nose. It's not abnormal. It is not normal. Then change of voice, cough persisting for a long time, for more than a month. Any lump or bumps in the body which is not there for the last several years and suddenly it has appeared. Whether the lump is in the breast, it can be on the skin, in the thigh, in the penis, in the balls, anywhere. If it is a lump, new lump which has come, it needs to be. So any lump or bump in the body which has come recently, weight loss. If it is more than 5, you are not trying to lose weight, but you are losing a lot of weight. You are having a good appetite, means you don't feel like eating at all, and because of which also you are losing weight. So these are all persistent fever. As I mentioned, these are all reasons for you to say that okay. So there is no age criteria for that. Any age, these problems are there. They need to go and check out. Doesn't, again, as I mentioned, this thing is that it is important to go and meet the doctor. It doesn't mean that you have cancer. Similar thing in our part of the country, that is in Chennai. If you have some dyspepsia, like you have acidity, some swallowing problem sometimes is there. In the night, some vomiting comes or regurgitation happens. But basically, some discomfort is there in the upper abdomen all the time. Everybody complains acidity. So they need to get a endoscopy done. Okay, so an endoscopy is important in those situations because it will pick up early gastric or a food pipe cancer. So again, that is this thing. Your food pipe cancer, common food pipe cancer is caused by tobacco, but the junction of the stomach and the food pipe, that area, the cancer is caused by if a person is obese or he has regurgitation of food or acid material into the food pipe again and again. The junction has got a valve actually. That valve, if it is loose, acid can come up. So over a period of years, it can develop into a cancer. So if you have something like that, an endoscopy will diagnose any similar problem for which some preventive measures can be taken, or an early cancer can be picked up. So that is the way you pick up this thing. So it can be in any age. You have to. These are the main issues that.
You mentioned prostate is amongst the top 5 in Tamil Nadu.
Yeah.
So, if you can share with the team, which are the top 3 in male and female in Tamil Nadu, because most of our colleagues are from this country.
So in females, it is breast cancer, cervix cancer, and now the other one is ovarian and uterine cancers. So these are the main in females. In males, now oral cancer is also part of that. But it is, I think, coming down because the chewing habit has come down in our, because they are banned a lot of things and all. But older ones still develop oral cancers. For men, it is either the oral cancers and then you have this prostate cancer also. But stomach cancer and lung cancer are high up on the this thing. So these are the 3-4 cancers which are common in the males. Screening for males is mostly done for prostate and for oral cancer. If the person is a smoker for a long time, in those situations, nowadays they may advise, if you come to say Apollo, they will tell you, okay, you have a HRCT. We do a high resolution CT scan of the chest to screen for any lung cancer, not an X-ray chest. It is and it has to be done every 2 years or every year to pick up a early lung cancer. Again, as I mentioned, it is not common in our country, and fortunately, not unfortunately, fortunately it is not common. Screening like this is done in Japan, China, in Europe, where everybody smokes. You can see going around the city, you will find everybody smoking. So fortunately for our country, it is not, but it is common in our country if you start counting which cancers are common. So lung cancer, stomach cancer, oral cancers, these are the most, and prostate cancer, they are all the common cancers in this part of the country, in men.
So if you take prostate cancer more specifically, does it anywhere related to masturbation?
No, masturbation has nothing to do with any of these problems.
Okay, lots of questions still coming. This is the last one because of paucity of time. A lot of people do yearly checks. Which are the ones which you recommend as a preventive?
So that is a very difficult question to answer actually, because anything you do, you cannot always prevent it. But you still have to screen, and a lot of people get picked up, cancers get picked up in the process. So in men, yes, as I mentioned to you, above 50, a PSA test. Then there's some other screening tests are there. We call it CEA, which may indirectly indicate about say colon cancer or the large intestine cancers. Other than that, oral examination has to be done. So these are for men. For men, an oral examination, PSA test, an examination of the motion passage, and the other thing is for checking for any blood in the motion. So we call it occult blood. So occult blood in the motion, if it is positive, we can indirectly say that okay, some colon cancer can be there. So you need to do these tests for men. For women, it is mostly mammogram after 45, not before that. And of course, if there is a family history of breast cancer, then you have to start screening 10 years before. Like say if the lady had the cancer at 40, her daughter has to start at 30. So that way it goes, the screen. Then you have to do an ultrasound of the breast, but otherwise mammogram. Then you have to do something called a pap smear, which I guess if anybody is married, they will be knowing. The gynecologist will do a smear of the cervix to pick up any cervical. It's a precancerous condition in the cervix which can be picked up and treated. So then, other than that, as the person grows older, you can do an ultrasound of the abdomen to check for any ovarian mass. Then sometimes after they have balls and all, an ultrasound to check there is a lining of the uterus which is called endometrium. So the thickness of that can be checked. Especially it is done only when you have some bleeding after the menopause in the females. Pick up uterine cancers. Please understand that these are not standard screening tests. They cannot be recommended. If you ask me, I cannot recommend them, as it will be very incorrect. So, but when you are going for a medical checkup, usually an ultrasound and this test somewhat will pick up certain things. But this pap smear and a mammogram for a female is very important. For a man, a PSA and an oral examination, occult blood test for both males and female is a good test to do after 50.
One last question. You are saying that a lot of organs cancers related thing. So what it is related to on the blood cancer and then the bone marrow kind of thing?
Okay.
Because that's a different factor, because the
Yeah.
human blood is a criteria for the entire thing. So there isn't some particular
Okay. So
organs,
what?
so
I understand your question. What you are asking is how to screen for that. So you have to understand that what I am talking to you is mostly about solid cancers which grow slowly and they give you an opportunity to get picked up early. All right. So these lymphomas or there is lymph nodes are there in the body. A cancer of the lymph nodes or the blood cancers, they are super fast growing. So if you don't treat them for 3 months or 6 months, the patient will die. So there is no way of picking them up early. They will, if they happen, they will present themselves with infections, fever, something will happen which will get you to take the person to the doctor, and when they do a blood test, they will automatically come to know. So there is no screening of that. It is so fast growing, but when they are so fast growing, the medicines, they will basically treated with medicines. So the medicines also act like that only. So they respond also very well to the medicines. So that is why there is nothing to screen that.
Is ulcer is a result of cancer, or is it a symptom of cancer?
So ulcer, yes. So if you have an ulcer on the surface of your body or inside your mouth, that is an ulcer, is a tumor, can be a cancer. It may not necessarily a tooth. If it is a sharp tooth, it can cause an ulcer. That ulcer may not be a cancer, but it can be, it will develop into a cancer if you ignore it for a number of years. Any ulcer which is not healing on the skin, it can be a cancer. It needs to be reported to the doctor, and then the doctor has to do a biopsy and check it and confirm. Any black spot on your skin, so that is called a melanoma. Your pigment cells in the body will produce a cancer called melanoma. No, I did not mention that is because in India, melanoma is not common. Okay, so the of the skin are common for people who are white, basically Caucasian. We call them Caucasian. So Australians, Americans, Europeans, they are all white. Okay, so they are white and our white is different. So they don't have pigment cells. So, or people who have freckles, girls have freckles because of exposure to the sun. They are more prone to develop melanoma. This is basically because of sun exposure. Our people are dark, so they have lot of melanin cells which will absorb any bad rays coming from the sun. So we don't develop melanoma so common. The only area where you can develop a cancer of these cells is here, under the foot, on the nail bed. It's not at all common, so we don't talk commonly about that.
Thank you everybody who joined in today's session, and immensely thank you Dr. Mahajan for being around and taking all these questions and your very informative presentation. And I'm sure you'll have a lot of questions, and now you know where to catch him. He is at Apollo. So thank you. We call it a day today for this evening, and thank you once again for our colleagues who are present here and those who have logged in. And this conversation will go around, so we wish you a lot of good health, and our journey of promoting good health as an initiative of GRT Hotels and Resorts will continue as we bring to you more events under the Great Being banner. Thank you everybody. Have a nice evening. Now I'm going to call Subhashish on the stage to a vote of thanks for a doctor, and hand him a little mentor.
Dr. Vikas, it's been very kind of you to come over and support us, this young house. There are a lot of facilities in our company also.
Yeah.
So we'll be in touch, as Jeet said.
Yeah.
We know where to catch you. And I think we should create this.
Yes, sir. Ready, sir? One more. Okay, sir. Thank you. Sir, ready? GM okay. Switch off.